Well, recently we got to sit down with Melinda Coghill. Melinda is the Medicare expert at 65 Incorporated. The company is really focused on providing tools to advisors as well as helping individuals navigate the maze of Medicare. And so Melinda really has some expertise in this area, both at a national level as well as a local level. She's also featured in a number of advisor-specific publications such as Advisor Perspectives and Financial Advisor Magazine. And so she is one of the experts that advisors turn to when we are stumped on navigating the maze of Medicare. And so let's look back at the recording when Melinda joined us to talk about Medicare and specifically the open enrollment period. Enjoy.
This is a subject we're very passionate about here. So what I'm going to do today is I'm going to, here, let me share screen. Hold on. All right. Fantastic. Okay. So that's me, blah, blah, blah. Yeah. The point is I don't sell insurance. So when I tell you what I tell you, the reason why is because literally your best interest is my best interest. So when it comes to Medicare, we're basically in what is called the annual open enrollment period, October 15th through December 7th. If you make any changes to the plans that you have, those new plans will take effect January 1st. Okay, Mark knows this because he and I actually were together in Denver about a week ago. And he's like, hey, do you want to talk about open enrollment? I'm like, yes, please, because I have a lot to say. Anyways, here's one of the main talking points. We deal with seniors all the time. So I'm going to tell you about some sort of common talking points, some common things that we hear. So there are a couple things that I always hear from clients, very common scenarios. So one of them that I hear very often, and in fact, I was dealing with yesterday. Hey, my friends are telling me that I pay way too much for Medicare. They pay nothing and they have all these like extras, free dental, and I don't have that. What the heck am I paying for? I want what they have. All right, so this is one of the first case studies I wanted to basically tackle. So what I'm talking about are the Joe Namath commercials. So Joe Namath is all over the place right now, whether in your mailbox or on your TV. And he is telling you that you can get all the benefits you deserve with $0 in monthly premiums. That's what he's saying. But Joe is not telling you the whole story. I'm going to tell you more of the whole story. So first and foremost, in order to understand what Joe isn't telling you, I'm gonna backtrack a little bit to make sure that we are all speaking the same language. You've probably heard Medicare has 4 parts, A, B, C, and D. We don't teach it like this because C is technically just a repackaging of A, B, and D. So we prefer to teach that Medicare has basically 3 basic parts and then 2 unique ways to get the 3 basic parts. Okay, so just so that we all remember, Part A is hospital insurance. This is the part of Medicare you work and pay taxes for in order to get premium free. This kicks in when you are officially admitted into the hospital. This is the part of Medicare that kicks in. Part B is medical insurance. This is the part of Medicare that covers doctors, nurses, specialists, outpatient procedures, labs, diagnostics, etc. In 2023, this part of Medicare will be going down a little bit to $164.90. I still don't think that's an amazing decrease because we had the highest increase ever on the books of Medicare between 2021 and 2022. So it's like, well, they gave you a little bit back. So I don't think it's worth a victory lap. Then Part D. Part D is prescription drug coverage. You do not get Part D drug plans provided by the government. The government sets the structure for how these plans work. All plans are provided by private insurance companies. Okay, those are the 3 parts of Medicare. Now, these are the paths of Medicare. These are the 2 ways that most people choose between in order to get their coverage. Some people have a military coverage path or a retiree coverage path, but those are extras. Everybody has at least the fork in the road. So we like to talk about these two paths in order to understand the differences. So first, I'll talk about the path of original Medicare. This, we put the Capitol building in the background because the government is in charge. They are administering the program on this path. And on this path, there are no networks. That is a big difference between this path and the other path. There are no networks. So if you are a snowbird and you go to Florida or Arizona for several months of the year, you never have to worry about networks. Okay. All right. Your Medicare card is a key piece of identification. If you have this path, typically you keep your Medicare card in your wallet. Okay. If you enrolled on this path of Medicare, you got started by enrolling in Part A and Part B. About 10% of Medicare beneficiaries stop right here. They say, I'm done. I'm enrolled in Medicare. Yay. No, boo. No, icky. Because unlike what Bernie Sanders will tell you, Medicare is not free. Anybody on Medicare knows Medicare is not free. Part A has a $1,600 hospitalization deductible. 20% of every bill, doctor bill, specialist bill, comes out of your pocket. And A and B, when this is all you have, has no spending limit. So if you're heading down this path, you don't stop here. You typically add a Medigap policy as well as a Part D prescription drug plan. Okay, when you add those two pieces, typically provided by different insurance companies, congratulations, you have comprehensive coverage. Woohoo! Yeah. Just a few more details about a Medicare supplement, Medigap, Medigap supplement. Those terms are interchangeable. Medicare Advantage is totally different. So Medigap supplement Medigap, that is on the path of original Medicare. The reason that it's called a Medigap is because it covers the payment gaps that Part A and Part B do not cover. Okay, Medigap policies are standardized. It doesn't matter which carrier you get the coverage from. The plans will provide the same benefits. You just have to pick which benefits you want in the state of Wisconsin. Now, here comes probably one of the most critical points of understanding Medicare. In order to get a Medigap policy or change a Medigap policy without medical questions being asked, you have to have a guaranteed issue right. Okay. People enrolling in Medicare for the first time have a guaranteed issue right for the first 6 months that they are enrolled in Part B. After those 6 months, you don't have a guaranteed issue right. Insurance companies can ask you about your health if you want to get a Medigap policy or change a Medigap policy. If they ask you medical questions and find anything they don't like, they can say, no, thank you. We don't want you. Bye. Leaving you without coverage. So that's a really super critical point to know about open enrollment. Okay. It's going to come up again in a little bit later. So let me build this whole path out for you. So Medigap policy, Part D prescription drug plan, Part A, Part B. Fully built out, you pay a monthly premium for the Part B Medigap policy and drug plan in order to have few, if any, additional out-of-pocket costs for healthcare services. Literally, please don't do this. None of you do this, but you could be hit by a bus and be in a hospital for 3 weeks and not see a bill. Okay? That's how this path works. Typically, these are some of the national averages to give you a sense about if you had Mark as a financial advisor, Mark would love you being on this path because he could grab that number, put it in your plan, and woohoo, we know exactly what to expect. All right. That's the path of original Medicare. Now, there's also the path of Medicare Advantage. All right. This path works totally different First and foremost, we put a corporate building in the background. On this path, insurance companies are in charge. They make the rules. You don't carry around your Medicare card, you carry around an insurance card because essentially you're having the insurance company provide all of your Medicare coverage. All right, it doesn't matter which path you choose. You have to enroll in Part A and Part B. It's not going to matter. So in order to get Part A and Part B services on this path though, you're following the rules of the insurance company. Okay, plans on this path usually roll in drug coverage. So you don't have to go get a separate Part D prescription drug plan. That coverage is rolled in. Okay, here come the parts that are very attractive that get everybody talking. $0 in monthly premiums, free dental coverage, free gym membership, free transportation. Get all the benefits coming to you. Okay. Yes, we got that. So it is true. It is true. More than 90% of Medicare Advantage plans in this country do include free fitness benefits, free dental coverage, telehealth, free hearing aids and exams, free eyeglasses and eye exams. Here comes the but. You knew it was coming. Here it comes. But what does it really mean to have these free benefits? Because I guarantee you, your definition of free does not equal the insurance company's definition of free. So what does it mean to have free dental, for example? Well, the first thing you need to know and the most important thing you need to know is something called plan limits. More than 6 plan limits are the total cap on benefits that you will have in any given year. The insurance company puts a limit on how much they will pay for those free benefits. About 60% of plans nationwide have a dental plan limit of less than $1,000 a year. So if you're thinking, I'm going to get my bridges taken care of, my crowns, no. It's safe-ish to assume you'll get 2 cleanings, a series of x-rays, and a fluoride treatment. Beyond that, forget about it. Forget about it. So those free eyeglasses that you're going to get, if you can find a pair for less than $160, sure, free. These cost me like $400 and some the last time I got them. So anyways, take it with a grain of salt. All right, now, there have been studies done that show that people with these amazing, free, exciting benefits really, when it comes down to dental coverage, really only save on average about $226 a year over people who have no free benefits. Okay, why am I bringing this up? Why am I hammering it? Well, the reason why is because there's a reason these free benefits are all over the commercials, because they're shiny and they're exciting. Think about a magician. A magician has their hands going wildly over here. Meanwhile, the trick is actually happening down here. They get you to take your eye off what really matters. Why we have health insurance is for the things that are guaranteed to bankrupt us. Heart attacks, strokes, Parkinson's, Alzheimer's, cancers. That's why we have health insurance. We don't have health insurance for a $25 CVS gift card each quarter. You can pay for that on your own. You don't turn your healthcare coverage upside down for a CVS gift card. Now, all that said, these do exist and they are nice to have, but we put them aside. You don't go get a bank because they gave you a free toaster, right? You don't go switching up your bank because they gave you a free toaster. No, you have to make sure all the banking stuff actually works. Same is true. All right, I've hammered that enough. Okay, so we put those free benefits aside. We need to keep our eye on what really matters. So Medicare Advantage policies provide a package of all of those benefits together. But remember, you're following the rules of the insurance company. You have to see providers in a network. By law, that network can change at any time. Providers in the network today may not be there 4 months from now when you have surgery scheduled. We've seen it happen. I have a horror story of a woman who was paralyzed from this. So if you're traveling outside of the network, you need to keep an eye on networks. You may not have coverage if you travel to Alaska or Washington State or Illinois. You may not. All right, that's rule number 1. Rule number 2, you are subject to prior authorization rules on this path. What does that mean, Melinda? It means the doctor may say, hey, Mark, your knee looks horrible. Have you been running too much? You need knee surgery. But before Mark goes and gets knee surgery, he or the doctor's office, somebody is going to have to reach out to the insurance company and get their permission. If they do not give their permission and Mark goes ahead with that surgery anyway, 100% of that bill will come out of his pocket. Spending limits only apply when you follow the rules. Not getting prior authorization is not following the rules. Spending limits out the window. Okay, so that's rule number, one other thing to know about prior authorization is basically prior authorization is everywhere in Medicare Advantage plans now. If the rule of thumb is if you want to do anything other than see your primary care physician, expect prior authorization. It's a little less true in the state of Wisconsin currently, but we look at what happens on the coasts, Florida, California, New York, those make their way inwards. And now with the advent of quartz here in the Milwaukee area, quartz means that now we have HMO plans where you can only see Aurora doctors. You can't see a whole bunch of doctors from Ascension or other places. Now Ascension's going to start responding by creating their own plan. And now before you know it, we're going to have a whole bunch of very specific networks. So wait for it, it's coming. So expect prior authorization, expect network restrictions. Oh, that's out of order. That's nice. Woohoo! Okay, so the third bullet point is you are responsible for paying deductibles, copays, and coinsurances whenever you use healthcare services up to the plan's out-of-pocket spending limit. So really, truly, when it's all built out, this path is the mirror opposite of how the path of original Medicare works. Yes, you are going to very likely pay no monthly premiums, but then you're going to pay every time you use healthcare services. And remember, you're following the rules. If you do not follow the rules, don't stay in network, don't get prior authorization, you are completely on your own paying the bill in some cases. So this is the budget on this path. I can tell you the lowest amount you will pay, $164.90. That's the Part B premium. If you never see a doctor, never have anything happen to you, congratulations, $164.90. But I can't tell you what you will actually pay on this path. It's going to depend on what happens. And I know nobody with a functional crystal ball. So there you go. That's really the choice. Now, this is why open enrollment is so important. Many people on this call have already enrolled in Medicare. You've already made your decision, your path decision, and you've headed in that direction. You don't know it, but an earthquake happened behind you. Now, if you want to change the types of coverage that you have, you can't do it willy-nilly. You have to wait for a period like open enrollment. Okay, now there's a bridge open, but that bridge has rules like the United States to Canada. You have to follow the rules. It is super easy, super duper easy to switch from the path of original Medicare with a Medigap policy to the path of Medicare Advantage plans. I'm just being honest. Medicare Advantage plans make a lot of money. They want you and they do not have to ask you about your health. They're going to take you. Here comes the problem. If you're on Medicare Advantage, your health changes, you're traveling, you're starting to see some of the disadvantages of Medicare Advantage, and you decide, I'm going to switch to that other thing now. That might not be possible because of guaranteed issue right. You only have a guaranteed issue right to get a Medigap policy for the first 6, sometimes 12 months that you are enrolled in Medicare or Medicare Advantage. After that period, they can ask you about your health and they can say, no, thank you, we don't want you. Surprisingly, there are now government studies being done that are showing the disproportionate number of people towards the end of life who decide to switch anyway cannot get a Medigap policy and prefer to pay 20% of everything with no spending limit rather than remain on Medicare Advantage. Think about that. There are government studies. You can go look it up. So yeah, so this is what Joe Namath is not telling you and why I put a big cross on his head. He doesn't have to tell you about prior authorization, network restrictions, or guaranteed issue right to switch back and forth. He doesn't have to tell you that. So he's more than happy to tell you about all the shiny things to get you to switch. So just know that. Just know that that's how that works. So second thing we hear, Melinda, I'm happy with my plan. It worked really well for me this year. Why would I waste time trying to review it? Aha. Come about between February and April of each new year, I see news stories and sound like this. Those awful drug companies keep gouging seniors. I used to pay $50 for my prescription refill. Now I pay $1,000, those evil drug companies. Yeah, it's much more likely that she just didn't review her drug coverage during open enrollment. The drug coverage changed, the formulary changed, the rules changed, and she wasn't paying attention. It's just how it goes. So Part D prescription drug plans and Medicare Advantage plans can change everything about the coverage from year to year. Literally, premiums, deductibles, out-of-pocket copays, spending limits, pharmacy networks, provider networks, and whether or not they have prior authorization or step therapy requirements, all while keeping the same plan name. It can be entirely different coverage next year with the same plan name. That's why it's important. It's great that it worked good for you this year. Next year's a totally different year with potentially a totally different plan. So that's why it's important. So we put together a little infographic, and it basically only 13% of Medicare beneficiaries typically review their plan options during open enrollment. You know who knows this? Insurance companies. They know they're free to make changes however behoove them. The other thing to know is about typically people overspend by about $368 per year that they have not reviewed their coverage. So if you haven't checked your coverage in 5 years, take that amount and multiply it by 5. That's about how much you're overspending. So our company has a record. Yes, we saved a woman $235,000 once by changing Part D drug plans for just 1 year. And for her, that was one brand name medication that did that. One brand medication. So thus, I have my triage. How important is it for you to review your coverage? Okay. If you can answer yes to any of these questions, it's critical. Number 1, has it been more than 2 years since you last reviewed your coverage? Critical. Has your health changed since you last reviewed your Medicare coverage? Okay, if so, critical. Number 3, do you take any brand name medications or 5 or more medications in general? If so, critical. So there you go. That's the triage. So how do you get help reviewing plans? Okay, well, there's actually lots of places where you can get help. First and foremost, if you've never seen the Medicare.gov Plan Finder tool, Medicare.gov, not .com, not .org, not .co, Medicare.gov. That's where you can compare Medicare plans really easy. If you have a MyMedicare.gov account, it's even easier because you can draw the prescription medications that you've had refilled. You don't even have to enter them. You just pick them from the system already knows. All right. Number 2, some insurance agents will review your coverage for you at no charge, but The big thing here is know that they will only likely review your plan against plans that they sell. You won't see the whole universe being offered. They will only show you things that you make commissions on typically. Pharmacies, some pharmacies will review coverage for you at no charge. But again, pharmacies, I had a woman yesterday who saved $7,000 by changing pharmacies, not plans, by changing pharmacies. So pharmacies are only going to show you costs at that pharmacy. The state health insurance programs also provide assistance at no charge, but these are staffed by volunteers, and hours and skill levels are going to vary greatly by the volunteers. And last but not least, organizations like us do plan reviews, but we don't sell insurance, so we charge a fee. So there you go. You can, there's goods and bads about everything. So that's right on par. Couple more points. I have about 3 minutes left. This is going to Mark. Mark basically really wants you to know not everybody pays the same for Medicare. No. Some people do pay more for Medicare. It's called the income related monthly adjustment amount. Irma is not a nice lady. She comes and demands more money. In 2023, if you take your adjusted gross income and you add it to your tax exempt interest, and it's greater than $97,000 for singles or $194,000 for couples, congratulations, Irma is coming to visit you. So Irma, it looks like this in 2023. Basically, these IRMA amounts are in addition to the standard Part B premiums and the Part D prescription drug plan premiums you pay. So yes, there's a Part B and Part D IRMA. So there is stuff that you can do to potentially save yourself money. Call Mark. Call Mark. I'm not kidding, especially with RMDs coming. If you're approaching 72, call Mark ahead of time. There's very little he can do when you're actually 72 and facing RMDs. But if you call him ahead of time, he can potentially help you a great deal with IRMA related stuff. So call Mark. I'm skipping past this, blah, blah, blah. Please know Roth conversions, capital gains, distributions, property sales, etc. Things that most financial advisors do without considering IRMA can actually trigger IRMA. Mark is different. He just is. He's one of the rare guys. I told him I was going to do this because I can do this. I work with financial advisors across the country. I know the difference between the average financial advisor that doesn't even know IRMA exists and people like Mark who do. So you want to work with the good guys. One last thing, Medicare does not cover long-term care, not a penny, nothing. 1 out of every 2 seniors believe Medicare covers long-term care, and that's their plan. It's a horrible plan. I'm just being honest. It's not going to pay for anything. And honestly, more than 70% of people who turn 65 will need long-term care at some point. We can wish it away, hope it away, but that's not going to work. So, and long-term care costs can be really expensive. So the sooner you have a realistic plan doesn't have to be long-term care insurance. There are other ways to tackle this. Talk to Mark. There you go. Final tips. Okay, final tips. Pay attention to Medicare and open enrollment. Don't listen to the commercials. And honestly, friends only know what friends know. Especially if they're healthy, they have no idea how their health insurance actually works. So whenever you talk to Medicare or Social Security, be sure to document the date, the time, who you spoke to, and what was said. Without that documentation, the government can give you wrong guidance, and good luck. What are you going to do? Sue the government? So be sure to document any conversations with the government. Consider IRMA, address long-term care needs sooner rather than later, and establish a budget, realistic budget for Medicare healthcare and long-term care. So there you go. That's my points. Any questions? I'm sure there are.
Melinda, this is fantastic. Yeah, feel free to come off mute or enter it in the chat. Melinda, I do have a question. Going from Medicare Advantage over the bridge back to original Medicare, what are some of the health conditions that might prevent somebody from making that leap, going back to original Medicare
God.
if they want to make that change?
So that's a really good question. There's a lot. And it depends on the carrier. So some carriers are stricter than others, but history of cancer, if you have like skin cancer in your history at all, even if it's cleared up, they look into that history. They can look into family issues. They can take blood samples. They can make you pee in a cup. So they basically do an entire workup. Do you have cancer? Do you have any heart-related issues, high blood pressure, diabetes, musculoskeletal conditions? All of it's up for grabs. If at first you don't succeed, try again. If the carrier that you pick as the #1 carrier won't take you, try another carrier. You might get approved. You never know. So
I would just like to say, Melinda, a great big thank you on behalf of everybody in Wisconsin Medical Society and WisMed Financial. It's terrific having a Medicare expert here that is not an insurance agent and selling the insurance. And so this is very valuable, having your expertise. So thank you so much for joining us today.
You're welcome. Have a good one, everybody.